What if I told you that millions of seniors check their blood pressure every single day, and still miss the number that matters most? Your doctor looks at two numbers. You probably know them, the top one and the bottom one. But cardiologists have been quietly paying attention to a third measurement. One that doesn't even show up on most home monitors. And research now shows it may be the strongest predictor of heart attack and stroke in people over 60. Stay with me through this video, because by the end, you'll know exactly what this number is, how to track it, and what to do if yours is in the danger zone. 1. The basics. Why blood pressure matters more after 60. Let's start at the beginning, because understanding this hidden number means understanding how blood pressure actually works inside your body. Every time your heart beats, it pumps blood through your arteries. That force creates pressure against your artery walls. That's your blood pressure. The number on top, called systolic pressure, measures the force when your heart contracts and pushes blood out. The number on the bottom, called diastolic pressure, measures the pressure when your heart rests between beats. So when your doctor says your blood pressure is 130/80, that means your systolic is 130 and your diastolic is 80. Now, for decades, doctors focused mostly on high systolic pressure. And yes, that matters. A systolic reading consistently above 130 is a red flag. But here's what changed. As researchers studied thousands of seniors, specifically people in their 60s, 70s, and 80s, they noticed something surprising. Some patients had perfectly controlled systolic pressure. Normal on paper. But they were still having strokes. Still having heart failure. Still dying from cardiovascular disease. The question became, why? What were doctors missing? And the answer came back to a number that had been sitting in the data all along, hiding in plain sight. 2. The hidden number, pulse pressure. The number cardiologists are now watching closely is called pulse pressure. And before your eyes glaze over at the medical term, this is actually very simple to calculate. Pulse pressure is just the difference between your systolic and diastolic numbers. So if your blood pressure is 130/80, you subtract 80 from 130, and your pulse pressure is 50. That's it. Simple math you can do right now on your next blood pressure reading. Now, what's a healthy pulse pressure? Cardiologists generally consider a pulse pressure between 40 and 60 to be normal for most adults. Below 40 can signal that your heart isn't pumping strongly enough, sometimes a sign of heart failure or severe dehydration. Above 60, and this is the danger zone most seniors don't know about, is called a wide pulse pressure, and studies show it significantly increases your risk of heart attack, stroke, and even cognitive decline. Let me give you some real examples so this clicks. Patient A has blood pressure of 140/90. Pulse pressure equals 50. That's in the normal range. Doctor focuses on bringing those numbers down. Patient B has blood pressure of 150/70. Pulse pressure equals 80. That's a wide pulse pressure. And that gap, that 80-point spread, is quietly damaging arteries every single day. Here's the thing, patient B might actually feel fine. No headaches. No dizziness. Readings don't look catastrophically alarming at first glance. But that wide gap is a serious warning sign. And this is exactly why so many seniors, and even some doctors, miss it. 3. Why pulse pressure widens as you age. So why does this become such a problem specifically after 60? The answer is arterial stiffness. When you're young, your arteries are flexible. They expand and contract smoothly with every heartbeat, like a rubber band. That elasticity naturally absorbs some of the force from each heartbeat, which keeps your pulse pressure in a healthy range. But as you age, those artery walls gradually lose their flexibility. They become stiffer, more like a rigid pipe than a flexible hose. When a stiff artery can't absorb the force of your heartbeat, that pressure has nowhere to go. So your systolic number shoots up with each beat, and your diastolic number may actually drop or stay low, because the artery isn't holding pressure the way it used to. That widening gap, higher top number, lower or stagnant bottom number, is the pulse pressure growing dangerous. Now here's what makes this especially serious for seniors. Wide pulse pressure doesn't just damage your heart. Research published in major cardiology journals has linked it to bullet operator increased risk of stroke, because stiff arteries can't buffer the pressure that hits delicate blood vessels in the brain. Bullet operator kidney damage, because the kidneys rely on steady blood flow and pressure. Bullet operator cognitive decline and dementia, because the brain is extremely sensitive to pressure fluctuations. Bullet operator heart failure, because the heart has to work harder against stiff arteries with every single beat. And one study from the Framingham Heart Study, one of the longest-running cardiovascular studies in history, found that in adults over 60, pulse pressure was a better predictor of coronary heart disease than either systolic or diastolic pressure alone. Let that sink in. Better than either number on its own. 4. How to track your pulse pressure at home. Now the good news. You do not need any special equipment to track your pulse pressure. You just need your regular blood pressure readings, and a simple subtraction. Here's what I recommend you do starting today. Step 1. Take your blood pressure at the same time every morning, before eating or drinking coffee. Sit down, rest for 5 minutes, then take the reading. Step 2. Write down both numbers, systolic and diastolic. Step 3. Subtract the bottom number from the top number. That's your pulse pressure for that reading. Step 4. Track it over 2 weeks. Don't panic over one reading. You're looking for a consistent pattern. If your pulse pressure is consistently above 60, that is the time to bring it to your doctor's attention, with those numbers in hand. Now here's a practical tip. Many seniors only read the blood pressure result and ignore what the numbers actually mean individually. From now on, look at the gap, not just the reading. A reading of 118/76, pulse pressure of 42, is healthy. A reading of 145/68, pulse pressure of 77, needs attention, even if your doctor says, the systolic is a little high but not terrible. You now know what to ask about. 5. What causes wide pulse pressure, and your risk factors besides natural aging. What else makes pulse pressure worse? Understanding these risk factors can help you take action before damage is done. 1. Uncontrolled high blood pressure. Long-term hypertension accelerates artery stiffening. If your blood pressure has been high for years without treatment, your arteries have taken a beating, and your pulse pressure may already be wide. 2. Atherosclerosis. This is the buildup of plaque inside artery walls. Plaque makes arteries thicker and less flexible, directly worsening pulse pressure. 3. Aortic regurgitation. This is when the heart's aortic valve doesn't close properly, causing blood to leak backward. It dramatically widens pulse pressure and requires medical evaluation. 4. Anemia. Low red blood cell count can cause the heart to pump harder, pushing systolic pressure up and widening the pulse pressure gap. 5. Thyroid disorders. An overactive thyroid can increase heart rate and output, which directly affects pulse pressure. 6. Chronic kidney disease. The kidneys play a major role in regulating blood pressure. When they're compromised, pulse pressure is often affected. 7. Lifestyle factors. High sodium diet, smoking, physical inactivity, and obesity all contribute to artery stiffening over time, all controllable factors. If you have 2 or more of these risk factors, tracking your pulse pressure isn't optional anymore. It's essential. 6. What you can do to improve your pulse pressure. Here's the section most people are waiting for. What can you actually do about this? First, I want to be clear. If your pulse pressure is consistently above 60, the most important step is talking to your doctor. Some causes require medical treatment. Do not try to self-diagnose or self-treat conditions like aortic valve problems or severe hypertension. But here's what the research shows you can do naturally to support healthier pulse pressure and artery flexibility as you age. 1. Move your body. Especially aerobic exercise studies consistently show that regular aerobic exercise, walking, swimming, cycling, reduces arterial stiffness in older adults. You don't need to run marathons. A brisk 30-minute walk, 5 days a week, can make a measurable difference in artery flexibility over months. This is one of the most powerful tools you have. 2. Reduce sodium. Excess sodium is one of the fastest ways to stiffen arteries and spike blood pressure. The American Heart Association recommends no more than 2,300 milligrams per day for most adults, and ideally closer to 1,500 for seniors with blood pressure concerns. Read labels. Processed and packaged foods are the biggest culprits. 3. Eat more potassium-rich foods. Potassium helps counteract the effects of sodium on blood pressure. Bananas, sweet potatoes, leafy greens, avocados, and beans are all excellent sources. Think of potassium as sodium's natural antidote. 4. Prioritize omega-3 fatty foods. Omega-3 fatty acids, found in fatty fish like salmon, sardines, and mackerel, as well as flax seeds and walnuts, have been shown to reduce arterial stiffness and support cardiovascular health in multiple studies. 5. Manage stress actively. Chronic stress elevates cortisol, which over time contributes to artery stiffness and blood pressure dysregulation. Deep breathing, prayer, meditation, gentle yoga, or simply spending time in nature, these aren't soft suggestions. They have real, measurable effects on cardiovascular markers. 6. Sleep. More than you think. Poor sleep is directly linked to increased arterial stiffness. Seniors who sleep fewer than 6 hours consistently show higher pulse pressure in studies. Prioritize 7 to 8 hours, keep a consistent sleep schedule, and address sleep apnea if it's a concern. Sleep apnea is particularly damaging to cardiovascular health. 7. Maintain a healthy weight. Every extra pound of body fat requires additional blood supply, which means the heart works harder and arteries face greater pressure over time. Even a modest weight loss of 5 to 10% has shown meaningful improvements in blood pressure and arterial health. 7. What to say to your doctor. Many seniors leave doctor's appointments with unanswered questions, or don't know what to ask. So here are the exact questions you can bring to your next appointment. Say, "Doctor, I've been tracking my blood pressure at home, and I noticed my pulse pressure is consistently above 60. Should we be concerned about arterial stiffness?" Ask, "Is there any reason to check my ankle brachial index or do further testing for artery stiffness?" Ask, "Are any of my current medications affecting my pulse pressure, either helping or making it worse?" Ask, "What pulse pressure target should I be aiming for given my age and health history?" These questions show your doctor you're engaged, informed, and taking your health seriously. And they open a conversation that most seniors never have, because most seniors don't even know to ask. Blood pressure is not just two numbers. It's a conversation between your heart and your arteries, and pulse pressure is what the conversation sounds like. Now you know what to look for. You know how to calculate it. You know the warning signs, the risk factors, and the steps you can take starting today. Your heart has been working for you your entire life. This is how you start working back for it. If this video helped you, please give it a thumbs up. It helps more seniors like you find this channel. And if you have a parent, sibling, or friend over 60, share this with them. It could genuinely save a life. Subscribe to Healthy After 60 for more videos like this every week, because your best years aren't behind you. They're ahead.